Hello, good morning, everyone. My name is Mariam, and today I'm going to be presenting this topic on behalf of Dr. Kivangwa from the Democratic Republic of the Congo. The topic is about should genetic testing for psychiatric conditions be implemented in Africa healthcare system? Dr. Kivangwa is standing on the stance for the negative team. To begin, we must recognize that cultural beliefs around mental illness in Africa could pose a barrier to genetic testing. In many African communities, mental disorders are often believed to have spiritual or supernatural origins rather than being understood as having organic or genetic causes. This cultural perspective can impact the acceptance and integration of genetic testing, as individuals may be hesitant to view mental health conditions through a biological lens. For our first point focuses on the cultural context and beliefs surrounding mental health in Africa. In many African cultures, mental disorders are not viewed as biological or psychological issues, but rather as a result of spiritual and ancestral disobedience. For example, conditions like bipolar disorder may be seen as a curse or a punishment from ancestors. As a result, therapy often involves rituals aimed to appeasing the ancestors rather than seeking medical treatment. This traditional view can create challenges in accepting mental health as a medical condition that may benefit from scientific approaches like genetic testing. Mental health conditions are often highly stigmatized, and in many cases, individuals with mental disorders may be viewed with fear or suspicion. Introducing genetic testing for mental health could be met with resistance, as it may intensify these fears and reinforce negative perceptions of the illness. This cultural stigma can make it challenging for genetic testing to be easily accepted or integrated into healthcare practices. Our second point highlights the lack of clear genetic predictability in mental health conditions. Scientifically, mental disorders are understood to have both spiritual and organic causes, making it difficult to pinpoint a single gene as a root cause. Instead, these conditions may result from mutations that affect multiple genes, which in turn influence brain proteins associated with behavioral disorders. This complexity means that genetic testing cannot easily identify a singular cause for mental illness, making it harder to provide clear, actionable results for such tests. For our third point, it focuses on the limited mental health infrastructure in Africa. Currently, 90% of African countries lack the necessary infrastructure and policies to effectively address mental health issues. Treatment of mental disorders is often expensive and can take years, creating a significant barrier to access. Establishing genetic laboratories in such an environment is challenging, especially when there is already a shortage of basic healthcare facilities to care for patients. Moreover, many families may not accept genetic testing as a viable approach given the lack of resources and the prevalent cultural attitudes towards mental health care. Our fourth and last constructive argument point addresses the risk of abuse by governments and institutions in Africa. Many policymakers lack sufficient knowledge of mental illnesses, which can lead to misinformed decisions about funding and policy. Without proper understanding, there may be little to no budget allocated to research institutions, hindering the development of effective treatment strategies for mental health conditions. This lack of support not only jeopardizes the management of mental disorders but also increases the risk of misuse of genetic research or testing if not carefully regulated. Our first repeated point addresses the potential for improved diagnostic accuracy and prognosis through genetic testing. While genetic testing may enhance diagnostic precision, psychiatric conditions are multifactorial, influenced by environmental, social, psychological factors in addition to genetics. Relying solely on genetic markers could lead to misinterpretations, overdiagnosis, or even false reassurance. Furthermore, psychiatric genetics is still in the early stages of development, and current findings lack clinical utility for guiding treatment decisions in African healthcare settings. where infrastructures are, and resources may not support the implementation of such technologies effectively. For our second point, it discusses the potential of pharmacogenomic testing in supporting personalized medicine. While this approach offers promise, its cost and accessibility remain significant barriers in many African healthcare systems. Additionally, psychiatric treatment is influenced by more than just genetics. Factors such as lifestyle, diet, coexisting conditions, and healthcare infrastructure play crucial roles in determining effective care. Moreover, current pharmacogenomic data for African populations are limited, meaning that tests may not yet provide reliable or actionable insights for personalized treatment, further complicating the implementation of such approaches in African context. So, for our third point, it focuses on the long term economic benefits of genetic testing. While genetic testing may help reduce some long term costs, the high upfront expenses of implementing such programs, including the cost of equipment, trained personnel, and counseling services, could place a significant strain on the already limited healthcare budgets in many African countries. Furthermore, psychiatric conditions often require ongoing therapy, social support, and environmental interventions, which genetic testing alone cannot address. Instead, investing in broader mental health services such as early intervention programs and community based care may offer a more cost effective solution for reducing hospitalizations and improving long term mental health outcomes. In conclusion, while genetic testing for psychiatric condition holds promise, its clinical utility, cost effectiveness, and ethical implications remain significant concerns within African healthcare systems. Psychiatry is complex and multifactorial, and relying solely on genetic insights risks oversimplifying mental health care instead of prioritizing expensive genetic tests with limited immediate applicability. African nations should focus on strengthening mental health infrastructure, investing in accessible treatment, and promoting community based interventions that address the broader social and environmental determinants of mental health. A holistic, patient centered approach, which lead to more equitable and impactful mental health care improvements across the continent.